Unfortunately, worldwide use of alcohol and other drugs contributes significantly to mortality, morbidity, and disability, resulting in the loss of many years of healthy life for millions of people, particularly in the young population. To understand why psychoactive substances can cause health issues, we must take a pharmacological approach and always bear in mind that they have different characteristics and can produce dependence and other mental disorders, as well as alterations in multiple organs and systems. People perceive the effects of drugs because their components bind to specific cellular receptors. The active component of alcoholic beverages is ethanol, which has three principal elements in its mechanism of action. 1. Inhibits the N-methyl D-aspartate glutamate or NMDA receptors. 2. By activating the GABA receptor, alcohol or ethanol allows the chlorine ion to enter the intracellular environment. 3. The overall result is neuron hyperpolarization. As a central nervous system depressor, alcohol activates the inhibitory neurotransmitter system and reduces the excitatory neurotransmission. These mechanisms produce the symptoms observed in acute intoxication, such as drowsiness, disorientation, decreased reflexes, and central nervous system depression in general. When smoking marijuana, people consume various mixtures of different parts of cannabis plants, which allows multiple components to pass from the lungs into the bloodstream, including around 70 cannabinoids, of which the most studied is delta 9 tetrahydrocannabinol, or THC, for its capacity to produce dependence. Cannabinoids have a neuromodulating effect, which means that the activation of CB1 receptors prevents the release of specific neurotransmitters from neurons, either dopaminergic, serotonergic, GABAergic, or of another kind. These pharmacodynamic effects cause these. First, inhibition of the enzyme adenylate cyclase, which produces lower concentrations of cyclic AMP. 2. Higher permeability of the cell membrane to the potassium ion. And 3. Decrease in the permeability of the cell membrane to the calcium ion. Together, the modifications in ion concentrations produce hyperpolarized neurons, which are more difficult to stimulate.